Welcome to this webinar on reflux. And today we're going to look at how you can get relief from your reflux through diet and lifestyle choices. My name is Marianne Williams, and I'm a specialist gastroenterology dietitian, and I specialize in gut conditions generally. So I just want to say who this webinar is not suitable for. It's not suitable for those who are very underweight or have a history of anxiety associated with food or are suffering with acute or chronic health conditions. For those people, I'd like you to seek medical advice before making any of the changes that are mentioned in this webinar. So, what we'll cover in this webinar today, we're going to cover the red flags for further investigations. What is reflux? The symptoms associated with reflux, dietary changes that might help your reflux, and lifestyle changes that might help your reflux. Please note that this dietetic webinar will not cover medications. Please see your GP or pharmacist for information on medications for reflux. So I said I was going to cover red flags. These are alarm symptoms that I would want you to go and get further investigation for. So things like difficulty swallowing or painful swallowing, weight loss, or any sign of bleeding in the gastrointestinal tract. So if you vomit blood or you have black tarry poos, both of those warrant urgent help immediately. So go immediately to A&E or your GP if you're either vomiting blood or you're showing black tarry poos. If you have persistent vomiting, unexplained iron deficiency anemia, and chest pain that's not associated with eating, then those also need further investigation. But the ones that really need very urgent investigation are the vomiting blood and the black tarry poos. So, our gut. The human gut runs from our mouth to our anus, and it is a continuous hollow muscular tube responsible for digesting food, absorbing nutrients, and eliminating waste. So, the section of our gastrointestinal tract that is affected by reflux is the stomach and the esophagus, shown here in the picture. So, reflux symptoms occur when acid moves up from the stomach in the wrong direction back up the esophagus or the gullet. And that shouldn't be happening. We shouldn't have acid moving back up there. Now, the acid in our stomach is actually hydrochloric acid. And to give you an example, it's used to remove rust from steel. So it is a very strong acid. People who have been sick down the outside of their car, for instance, will know that it's taken the paint off the side of the car. So it's a really strong acid. Definitely not an acid that you want to move up into your delicate esophageal area. So there is a cardiac sphincter, and this is at the top of the stomach, just at the bottom of the esophagus and at the top of the stomach. And it lets food, it opens up to let food and drink pass into your stomach. And then it closes tightly to stop the stomach acid from moving back up into the food pipe or the esophagus. If it doesn't close properly, stomach acid will flow back up and you'll get that burning feeling in the chest. In this webinar, we're going to often refer to this cardiac sphincter as the valve, and the valve that should prevent acid from moving up into the esophagus. So if you hear us refer to the valve, we are actually talking about this cardiac sphincter. So, what symptoms are associated with reflux? Well, I thought it's simpler to give you examples of how people describe these symptoms. So, one of the big symptoms that people refer to a lot with reflux is heartburn, and they say it feels like something is on fire in my chest, or I thought I was having a heart problem, but it was actually just really bad heartburn. Water brash is another symptom of reflux, and people often describe this as I get a sudden flood of liquid in my mouth. It tastes sour and acidic, or it feels like I'm about to be sick, but instead I just get this watery, bitter fluid. A hoarse voice. People with reflux often describe having a hoarse voice. They'll say things like, my voice sounds rough, raspy, or scratchy, especially in the mornings, and I feel like I have to clear my throat constantly before I speak. And a cough. People often describe having a cough as if something's stuck in their throat or a drip is irritating. It's a dry cough that just won't go away. A sore throat. People often describe having a sore throat. They say, I've got a constant sore, scratchy throat, but I'm not sick. So they haven't got a cold or any reason for that. And it feels like my throat is burning or raw, especially after meals. Globus is another feeling, and that describes the feeling where you feel like you've got a lump in your throat, and when you swallow, but there's nothing there. It feels like there's something stuck, like a pill or a bit of food that won't go down, and that's described as globus. Now, the other area is silent reflux. So there are actually a lot of people that are actually completely unaware that they're suffering from reflux. And they only discover that because, for instance, they go to the dentist and he discovers damage or erosion to the back of your teeth. And if you think back to what I was saying about the hydrochloric acid taking rust off steel, you can see that if you're constantly every night getting silent reflux with acid bashing against the back of your teeth, it's going to start taking the enamel off your teeth. Silent reflux, often if you have a hoarse voice, you might get referred to ENT or ear, nose and throat specialist, and they might find that acid is actually coming up and irritating or damaging your voice box. So it's not just the teeth it can damage. And also, reflux that affects the top of the airway might be diagnosed as laryngopharyngeal reflux by a respiratory specialist. And this particular type of reflux often causes many of the symptoms we've already discussed, like the hoarse, croaky voice, especially in the morning, frequent throat clearing, chronic cough that's not linked to a cold, a sore throat and a burning throat that also isn't linked to a cold, a feeling of a lump in the throat, the globus that we discussed earlier, difficulty swallowing or feeling that food is stuck, excess mucus or a postnasal drip, and a bitter or sour taste in the mouth with occasional shortness of breath or wheezing. So, people with reflux often also describe chest pain, and chest pain with reflux is associated with eating and not with exercise. And there's a very important distinction there. So, reflux typically causes a burning chest pain, but it can also cause a non burning discomfort depending on the person and the causes. But as I said, it's really important to register whether chest pain is sudden, severe, and it should always be checked by a GP or an emergency service to rule out heart related conditions. So if you suddenly suffer from unusual chest pain or severe chest pain, it must be investigated immediately. And again, chest pain with reflux is always associated with eating. It's not associated with exercise. So if you get chest pain when you're exercising, it's important that you go and get investigations done. There are other terms that come up when people are talking about reflux, particularly dyspepsia and indigestion. And I thought I'd just cover those quickly so that you know what they mean. And dyspepsia is a lower pain just under the rib cage. It's a fullness after eating. You have discomfort even if you haven't overeaten. And you might get pain post eating with or without the burning sensation. And dyspepsia and reflux are actually, there's a lot of common overlap between them, but the treatments are quite different. So it's really important to work out which you're suffering from. Indigestion is actually a non medical term, it's a general description for upper gut symptoms and discomfort. So, what can you actually do? What can we do to help the reflux? If we look at diet and reflux, what is the evidence for that? And I'm going to cover today alcohol, fizzy drinks, caffeine, fatty or large meals, citrus fruit, dairy, and eating habits, and look at how each of those may be related to reflux. So, looking first at alcohol and reflux and understanding the link. So, regular alcohol is linked to higher rates of reflux and it can worsen the heartburn, worsen symptoms. But some report there's no clear link. So, some people will drink alcohol and not get any reflux at all. What's actually happening here is that the alcohol is actually loosening that valve, that cardiac sphincter we spoke about earlier, loosening that valve and making acid more likely to go back up into the esophagus. The other thing alcohol does is it actually raises the acidity of the stomach acid. So you can imagine this acid is already unbelievably strong, but it's making it even stronger and more likely, therefore, to cause damage. And if it's going up into the food pipe, and the food pipe can actually be made weaker, the lining of that food pipe can be made weaker by alcohol. So suddenly you've got this extra acidic liquid moving up into a weaker area. And so the damage is much more likely to occur. The other thing with alcohol is it actually weakens the effect of reflux medications. So those PPI medications like omeprazole, etc., that you might be taking may work less efficiently because of alcohol. And the other thing is that it makes stomach acid, it makes the stomach empty more slowly. So stomach acid stays longer in there and is more likely to be pushed up into the esophagus because the stomach is just emptying more slowly. Does the actual type of alcohol matter? Well, sadly not. Beer, wine, and spirits can all trigger symptoms, and even their low alcohol versions can trigger symptoms. It's not just the strength that might impact the reflux. And obviously, if you drink more frequently and heavier drinking, reflux is more likely to occur. But basically, any type of alcohol can cause problems. And most research shows a clear connection between alcohol and reflux, even though not everyone will see symptoms when they drink. But overall, alcohol is definitely seen as a common trigger. So, moving on to carbonated drinks, so fizzy drinks. Well, fizzy drinks release gas and that stretches the stomach, which then weakens that valve again that keeps acid down. So this can trigger acid to flow back up into the windpipe. Plus, that bubbles and the acidity that come with the bubbles may also irritate the food pipe lining. So the lining of the esophagus might get more irritated. So when stomach acid comes back up, it's more likely to cause damage. But the research is mixed. There's no research that's really proven a link between fizzy drinks, but there does seem to be anecdotally people repeatedly comment that fizzy drinks will cause problems. What about caffeine? A lot of patients that see me ask about caffeine and should they reduce their caffeine to help their reflux. So, what is the actual evidence here? Well, I wanted to start by looking at the caffeine content of different drinks. Now, I've highlighted here instant coffee and black tea because you'll see the amount of caffeine in there is actually very little difference between the two. So, people often say to me, oh, well, I'll just move on to tea. I won't have coffee. Actually, there's no point in doing that because the caffeine content can be almost as high in black tea as it is in instant coffee. Obviously, green tea is slightly lower and decaf is definitely much lower, and herbal teas don't contain any caffeine at all. So, how does caffeine cause reflux? Well, caffeine, it appears, increases the acidity of that stomach acid. So, it's more acidic than it is normally. And then that acid, if it travels up into the esophagus, is going to therefore cause more damage to the lining of the esophagus. But scientific studies are mixed. Some show no effect. Some studies actually show that decaffeinated coffee can cause symptoms as well. So it's possible that there's another compound in coffee beans that is responsible, and therefore, actually, decaf sometimes doesn't work for people. Coffee and stress. Clearly, if you're very stressed and you're drinking coffee, you may associate your symptoms with the coffee when actually the stress is more relevant. And we'll go into stress in a little bit more detail later on. So, what practical tips can we talk about for caffeine and reflux? Well, you can try that decaf coffee and tea and see if it feels better. You can avoid coffee and tea on an empty stomach, that will definitely help. And you can limit caffeine intake if symptoms are worse after drinking it. And test the different types of teas, for instance, green tea, herbal teas, low caffeine options. Just try different things until you find something that is suitable for you if you find that these drinks generally cause problems. What about meals and fatty meals? Does it really make any difference, the fat content or the size of the meal? So, large meals, a bit like we were talking about with carbonated drinks, actually stretch the stomach and make that valve relax more. And that lets acid flow back up into the stomach. And also, when we have large meals or fatty meals, we release a hormone called cholecystokinin, and that again relaxes the valve at the bottom of the food pipe and slows down stomach emptying. So, stomach stays stretched for longer, and that increases the likelihood of reflux. So, in summary, research shows that big or fatty meals are indeed likely to trigger reflux symptoms. Looking at citrus fruit, a lot of patients ask me citrus fruit, should they remove it from the diet? And they feel that it does aggravate symptoms. In fact, there is absolutely no evidence that there is any link. But I would say that putting an acidy food onto a already sore area in the esophagus, as in when you're swallowing it, may well make your symptoms feel worse. But there's no evidence that citrus fruit themselves cause reflux. Dairy is another area. A lot of patients ask whether they should use a dairy free diet for their reflux. And there's been a large study looking into exactly that. And there was no increased risk of developing reflux from this study. What I do find, however, is that people with cow's milk allergy can present with symptoms very similar to reflux, But there's a distinct difference here, and this is not associated with typical reflux. So generally people, 99.9% of the people I see with reflux, cow's milk allergy is not relevant to them, and therefore doing a dairy-free diet will not help. Avoiding eating late. So eating meals within 2 to 3 hours of bedtime is definitely associated with increased reflux. So avoid late night meals and bedtime snacks, and try and take time to eat. Research often shows that eating slowly and in a relaxed atmosphere will improve your reflux symptoms, reduce your reflux symptoms. So where possible, try and eat in a relaxed environment and take your time. So I promised that we'd look at lifestyle changes as well. And I'm going to look at carrying extra body weight, smoking, stress, and raising the bed, and how those all can affect reflux. So first of all, if we look at abdominal obesity. So research repeatedly shows that if patients have got carrying a lot of weight around the central area, even if they've got a normal body mass index, in other words, their height and weight is normal, their height for their weight is normal, you can still suffer with reflux. So that excess belly fat puts pressure on the organs in your abdomen and raises the pressure, making it easier for acid to flow back up into the esophagus. It can also lead to a hiatal hernia, which can then weaken the valve and make reflux more likely. And that belly fat can cause the valve to repeatedly relax, which allows stomach acid to move back up into the esophagus. And belly fat also, unfortunately, causes inflammation. So that fat tissue releases chemicals that then increase inflammation and weaken the lining of the esophagus, making it more vulnerable to damage from that acid. And that may actually help explain why people with obesity are more likely to have severe symptoms resulting from reflux. So, conditions such as esophagitis or Barrett's esophagus, which are the severer end of the conditions caused by reflux. So, what about weight loss and how will that actually help? So, the evidence now shows really clearly that a weight loss of over 10 kilograms or about 10% weight loss has been shown to really resolve reflux symptoms and allows actually many patients to reduce or discontinue their PPI medication. And the American College of Gastroenterology guidelines now recommend weight loss specifically for helping reflux symptoms in patients that are overweight or obese. What about smoking? Smoking and reflux. Well, smoking weakens that valve that keeps acid down yet again. Tobacco also slows down the natural muscle movements of the esophagus. So the esophagus, the muscle aligning the esophagus will contract and expand in waves, creating a wave-like movement. And this moves food and moves items through the esophagus into the stomach. But actually, tobacco slows that natural movement. So acid that's come up into the esophagus is going to stay there longer, causing more damage and irritation. And actually, this may well explain why smokers tend to have the more severe symptoms of reflux, like esophagitis and Barrett's esophagus as well. Stress. So, studies are continuously showing that moderate to high stress can nearly double the odds of experiencing reflux compared to those with no stress. The American Gastroenterological Association in 22 recommends that where applicable, clinicians should discuss the association between the gut and the brain, the gut-brain axis, and its effect on reflux, and signpost where possible to supporting information. So there is unquestionably a connection between the gut and the brain. And stress will really have an effect on the gut in various ways and can cause reflux, it can cause irritable bowel syndrome, it can cause all sorts of symptoms. So, how does stress actually cause the reflux? Well, stress makes the esophagus more sensitive, so people feel the pain and the discomfort more strongly. It affects the nerves and the hormones that control that valve again, making it weaker. And it weakens the esophagus, making it more prone to inflammation. And stress also often changes people's lifestyle. It might increase the amount they smoke or drink. It might lead to poor dietary changes and irregular eating patterns because they just don't have time to cook, or they're relying more on processed, quick junk food, all of which can make reflux symptoms worse. So finally, raising the bed. There is a lot of evidence in multiple studies that raising the bed by 6 to 8 inches, or about 15 to 20 centimeters, can significantly improve nighttime reflux symptoms and reduce the exposure of acid onto that esophagus. So it's definitely something worth trying, particularly if you're getting nighttime reflux symptoms. So let's have a quick summary of what we've learnt here. So reflux occurs when acid flows back up from the stomach into the esophagus where it shouldn't be. It can cause symptoms of heartburn, water brash, globus, cough, persistent throat clearing, sore throat, hoarse voice, and chest pain. And it can cause damage to your esophagus, your voice box, and the enamel on your teeth. And in fact, you may be completely unaware that you're even suffering from reflux because you may suffer from a condition called silent reflux. In summary, with the food elements and diet elements, alcohol, carbonated drinks, caffeine, fatty large meals, eating late, and not taking time to eat can all have a significant effect on your reflux. And the lifestyle areas would be weight loss. If you're overweight, can make a huge difference and can actually stop you needing any PPI medication. And a weight loss of over 10 kilograms or 10% weight loss can make a massive difference. Also, addressing stress with mindfulness or cognitive behavioral therapy or hypnotherapy and raising the bed end can all make a huge difference. So I've put here a list of references that have been used. They're all very recent references. And if you want to read up more on these areas, then please do have a look at those. And I've also put some helpful contacts here. So Guts UK charity, they have a free to download heartburn and reflux information booklet. Simply go to their website, which is www.gutscharity.org.uk. And also, if you go to their information page on heartburn and reflux and scroll halfway down that page, you will find a video on medication for reflux, which some people may find very helpful. The charity Mind have information on cognitive behavioral therapy, CBT, and mindfulness for those who are suffering with stress. Go to www.mind.org.uk for that. And the Nerve app for hypnotherapy, they have courses on their app. And this is when stress is impacting your gut brain axis and causing gut symptoms such as reflux or IBS. Go to www.nervahealth.com for that. And thank you very much for listening. And please don't hesitate to email me if you have any further queries. Goodbye.